Hello, my name is Barb Winters. Welcome to Today's Health. According to the American Cancer Society, in 2006 there were 175,000 cases of lung cancer diagnosed. Joining me to discuss this important topic is thoracic cardiovascular surgeon Dr. Vernon Denclaw. Dr. Denclaw, welcome to Today's Health.
Thank you, Barb. It's good to be back on Today's Health.
Well, it's good to have you here, and this is an important topic, impacts a lot of people. So let's start with the definition. What is lung cancer?
Lung cancer itself is a malignancy or an abnormal growth of tissues or cells that derive from lung tissue or the air passages.
What increases your risk for lung cancer?
That actually is a one-word answer: smoking. There are a number of other things that have a minor impact, such as secondhand smoke being the most important, family history. There are a number of environmental factors, such as industrial products and things like that. But smoking is so far ahead of the others in creating this disease that the others barely bear mentioning.
So is it fair to say then that smoking causes lung cancer?
Absolutely.
Do other things cause lung cancer? Is it always smoking? Can you get lung cancer if you don't smoke?
90% of lung cancer cases are among smokers. There's another 10% that have a variety of factors, but most of those times we really don't have a causative factor.
Are there different types of lung cancer?
There are a number of different types. Small cell cancer, adenocarcinoma, squamous cell carcinoma, large cell undifferentiated carcinoma, bronchoalveolar carcinoma is a type of adenocarcinoma. But really, when it comes down to typing lung cancer, we call small cell in a category of its own, and then essentially the others are behaviorally so much different than small cell and are treated in a block like each other, that we essentially say small cell and non-small cell cancer of the lung, which is just everybody else.
Okay. What are symptoms of lung cancer?
Unfortunately, the symptoms in lung cancer do generally not present themselves until far into the disease process. The most common of them can be chest pain, shortness of breath, coughing up of blood, and then you have some generalized features such as weakness, fatigue, a variety of other things that really don't come into play unless it's a very advanced phase of the disease.
Is there any screening for lung cancer?
There are a number of screening processes that one can use. Chest x-rays, cytology of sputum, which is essentially what you cough up. However, statistically, these have never been found to save lives. Regardless of the studies and how they're performed and how they segmentalize or sequester people into those studies.
So it isn't like mammogram or something that you can screen for lung cancer on a regular basis, because of course any time that the symptoms don't come till real late, you worry about that.
Yes, in spite of all the efforts to develop screenings, there are no blood tests, there's nothing that really can reliably catch these at an earlier phase, although frequent chest x-rays are still done, but it really doesn't change the process.
So you're going to tell me the most important thing is to prevent it by not smoking.
That's first, second, and third.
Okay, sounds good. Well, we're going to take a break, and we come back and we're going to talk about how do you make a diagnosis. But first, this message.